So there are a lot of changes happening, so a small business owner needs to be aware of what's going on in the area of the health care. And some of the legislation that passed in this most recent year really will affect our smallest businesses, particularly those between 2 and 50 lives. One of the things that we were able to accomplish was currently in code there is almost a penalty for being a small business owner in that you had to offer health insurance for employees who worked more than 25 hours. We're taking that back up to 30 hours so that small businesses are treated similar to all other businesses. You know, there are rules now that talk about affordability issues. There are rules that talk about how many people you employ, what those numbers are, and whether or not you have the ability to get penalized based on those numbers. And I think that's one area that employers, both large, medium, and small, all need to pay attention to, is where they fall in the penalty rankings. So for a larger business, the Affordable Care Act has made the business owners really focus in on, paying attention, knowing who they're employing, because it becomes very critical that they understand who do they have employed, how many people do they have employed, what are the hours those folks are working, and really get a firm grasp on it. Although most of the effects of the Affordable Care Act aren't affecting them yet, they will be. And because they're larger organizations, they need to start to pay attention to that. The other area that it truly affects them is, as a larger employer, even though they have more flexibility in their health care plans right now, the carriers themselves are limiting the options because they're looking at the marketplace and saying, you know what, I don't need to have 30 different plan selections. I can narrow that down to 10 plan selections. And so that's affecting the choices that are being made for the larger employers. One of the interesting things that we've seen with the advent of the Affordable Care Act is the carriers looking and going back to much smaller numbers for self-funded plans. So now those, quote, what we call a larger business, that 50 life and up group, now actually has a lot more opportunities to look at some creative ways of managing their health care. As far as the cost goes on health care, I think we're really looking at, if we kind of suggest that trend is maybe 12.5%, is sort of the baseline trend that we've been kind of looking at for several years. I expect to see that continue to go up for just a brief period of time. Then it will stabilize and potentially lower. But what we're really seeing is, an average is great. But so an average is just an average, which really means that people are falling above it or below it. And we are really seeing a wide variety of renewal numbers coming in and trend numbers coming in. And it's really based on age, it's based on the plan design, and it's really based on what were you before. Were you sick or were you healthy before? And if you were a sicker group overall, then you're seeing a much less increase. If you're a very healthy young group, you're seeing a bigger increase. Because what we're doing in healthcare now with the new rules is we're leveling out the effects of age and of health of the group. So if I had a choice of what I could say needs to be done as we go forward and work with this Congress down in D.C. on making some changes, there's some specific areas that really, I think, hurt employers and actually, quite frankly, individuals as we look at our health insurance plans. Some of them are the lack of choice in being able to pick a plan that really fits your needs. We have customized to the average person, and the average person isn't there. There's a wide variety of people's individual needs, and the plan choices, because of the essential health benefits, are very narrow in how much flexibility you have. When the Affordable Care Act went to guaranteed issue, I don't think the carriers necessarily had a problem with moving to guaranteed issue. The problem is that you literally can be on your way to a surgery, and essentially it's possible to sign up for health care at the same time. That makes no logical sense. So enacting some kind of either a waiting period or a requirement for continuity of coverage seems to make some common sense. And I think we need to be looking at that. Again, the flexibility on style of plan and what's available. When the Affordable Care Act came out, it had a loophole in it that allowed us to do plans that were just essential health benefits that could then be matched up with voluntary benefits, so a person could construct a plan that fit for them, their family. That's going away. We need to allow that to happen so that folks can actually construct a plan that works for them. And then in the area of the penalties and all of the rules and all the taxations, that needs to be more clearly defined. There's a lot of ambiguity. People are concerned about, what is a full-time employee? I mean, we know we can go to the definition, but if I'm hiring somebody and I don't know whether I need them full-time, or I don't know whether I'm going to need them 12 months out of the year, I'm going to look at that person and I'm going to have some real concerns about, does it make sense to hire or does it not make sense to hire? And those get to be real traps for employers.